بسم الله الرحمن الرحيم. I'm going to talk about الدور بتاع الإيميجينج in COVID-19 patients, whether they are confirmed or suspected. الرول بتاع الإيميجينج in COVID-19 there are variable aspects of importance بتاعت الإيميجينج. أول حاجة هي likelihood of disease من الإيميجينج. it can تقدر تقول إن الصورة دي صورة الأشعة أو CT scan ده هو highly suggestive of COVID. أو من الأشعة or CT scan you can say COVID is unlikely. So من imaging it can give you an idea about the likelihood of disease. وفي بعض الحالات وبعض الدراسات إذا الإيميجين هو typical of COVID و clinical history also consistent، يعني التاريخ المرضي والإيميجين consistent with COVID، المريض يعتبر COVID-19 positive ويعطى diagnosis COVID-19 pneumonia حتى لو التست حتى لو ال PCR test was negative. Another role للإيميجينج هو to assess severity، يعني أنت depend on how much of lung fields كم من lungs are affected by disease process. You can say this is a mild disease or a moderate disease or severe disease. Imaging also it will help you to see if alternative diagnosis like patient suspected COVID came with chest pain and shortness of breath, found to have pulmonary embolism, no evidence of COVID, or X-rays suggestive of heart failure. نذكر إنه just reminder إنه imaging is not needed in all patients with COVID. ما أي مريض بتاع COVID لازم يتعمل له imaging. إذا المريض if patient عنده mild symptoms أعراض خفيفة normal oxygen level ما يحتاج أصلا تعمل له أي نوع من الأشعة. برضو need to remember that إنه imaging could be normal في ال initial stages of disease، يعني المرض يا دوب يومين ثلاثة you expect the X-ray may be normal, CT scan may be normal. Imaging modalities which are used in COVID-19 هي mainly chest X-ray and CT scan. طبعا CT scan there are different protocols for CT scan: non-contrast CT, high resolution CT, CT pulmonary angiography. Also ممكن أيضا thoracic ultrasound can be used but it has very limited use. أكتر شيء هي في المجال بتاع research or if patient is critically ill patients who cannot be safely mobilized to to radiology department for doing, for example, a CT scan. So you can try to use a bedside thoracic ultrasound to see if it can help to identify any abnormalities. chest X-ray هي طبعا أكثر imaging modality used. هي ممكن تستخدمها كبورتable X-ray، ودي ميزة كويسة إنه it will reduce the risk of moving the patient around وبتقلل الريسك بتاع الانفكشن. typical changes usually start at the basis. bilateral changes usually start at lung basis زي ما شايفين هي and lung periphery، يعني هي ممكن تظهر هنا clearly هي lung periphery في air space shadowing and consolidation. Again في بداية ال early stage of disease X-ray could be normal, X-ray may show unilateral infiltrate. هنا بنشوف two X-rays لنفس المريض. هنا في ال left hand side على ال left hand side you can see the initial X-ray، ده أول ما جاء للمستشفى المرة الأولى. ال X-ray كان clear and no major abnormality there. مريض خرج البيت تعب رجع بعد 10 أيام and you can see here extensive airspace shadowing typical of COVID because it's bilateral, mainly in the basis and the lung periphery. هنا this chest X-ray show moderate to large unilateral pleural effusion, which is atypical of COVID. يعني عادة unlikely to be caused by COVID. Isolated unilateral large pleural effusion. هنا another X-ray showing large pneumothorax on the right hand side. Again, the unlikely to be caused by COVID. كما تحدثنا سابقا chest X-ray can be used to assess severity of disease. هنا بنشوف this chest X-ray بنشوف ground glass changes mainly here in the right middle lobe, and this is classified as a mild disease based on radiology. هنا this chest X-ray هنا show bilateral disease في right هنا, وهنا in the left hand side also there is airspace shadowing, and it's more dense, and it's not mild ground glass opacity, it's like more dense consolidation, and this is considered a moderate disease. هنا بنشوف more areas of the lung are involved and bilaterally, عشان كده this is classified as moderate to severe disease. هنا almost all lung fields have been involved on both sides, عشان كده radiologically this is classified as a severe disease. CT scan is more sensitive than chest X-ray, but specificity again is not very specific to COVID-19. Changes can happen with other lung conditions, especially other lung infections like pneumocystis jirovecii, other viral infections like influenza. So these changes suggest COVID-19 during the pandemic, but it's not specific to COVID. It can happen with other conditions. Early changes here, ground glass opacities bilaterally start at the base, as in X-ray, start at the base at the lung peripheries. You can see here ground glass changes. Here again you can see ground glass changes bilaterally. وهنا في right lung posterior you can see dense area of consolidation. Here you can see ground glass opacities, and in between the ground glass opacities you can see secant septi زي ما في هنا في هنا for example. والcombination بتاع ground glass opacity و septal thickening بيدي appearance of irregular paving pattern، يعني إنه كأنه رصيف غير منظم. Irregular paving pattern called crazy paving pattern. COVID pneumonia may not be the only pathology causing patient symptoms. يعني يمكن الأعراض تكون لازم to look for associated things like the مريض هو typical COVID symptoms. You can see in the CT scan ground glass changes bilaterally. هو although clinically fever settled, inflammatory markers coming down, was still hypoxic, so اتعمل له CT scan, and you can see CT pulmonary angiogram, and you can see filling defects here for example, and here bilateral filling defects, multiple PEs, improved بعد ما بدأ على anticoagulation. So it's important when dealing with COVID patients who are not improving to think of pulmonary embolism, think of heart failure caused by the virus or by other reasons. هنا في list ب atypical findings in COVID-19 patient، يعني إذا مريض كان بواحد من الفايندينج دي pleural effusion a lot of cavitary lesions, pneumothorax. It is unlikely to be caused by COVID. You need to think of other problems. thoracic ultrasound ما بتستخدم كتير في ال assessment of COVID-19 patient, and mainly because أول شيء it will be time consuming لأنك you need to do different views, so it will take longer time لما تغير بالكيس اكس راي أو حتى يوم بالسي تي سكان. الحاجة الثانية إنه when you do thoracic ultrasound this need prolonged يعني prolonged direct contact with the patient, this will increase the risk of infection. So it's not commonly used in practice, لكن in rare situation like critically unwell patient cannot be moved or mobilized to any other place, then you can do thoracic ultrasound. Data from China about use of thoracic ultrasound in COVID-19 patient. Common finding were multiple B lines. هما B lines, the vertical lines. You can see it here. This B line, this is a B line. هنا في B line. هنا في B line. هنا the B line as well. So a lot of B lines. The B lines represent second septic يعني إنه due to inflammation or due to edema. So it's not specific to COVID-19 again. This finding بتشوفها في heart failure. You can see it in other pulmonary infections. You can see it في ARDS due to any reason, because in ARDS there is pulmonary edema, there will be second septic, so you can see similar finding. Another finding في ultrasound, you can see it in patient with COVID-19. Here consolidation usually subpleural زي ما ظاهر في الصورة, subpleural consolidation, and again this consolidation can happen with, it's not specific to COVID, it can happen with other lung infections as well. شكرا جزيلا وفي أمان الله. السلام عليكم ورحمة الله وبركاته.